Hi, this is Andy Valencia from the British Veterinary Hospital, and I'm going to talk to you about probably the most difficult part of my job, which is the decision-making process. It sounds a bit wishy-washy, but actually it's something that that comes into every decision that every vet and every sort of animal owner will need to make, and it's really about having to think about procedures and everything essentially as potential risks and potential benefits. If we take a vaccination, for instance, and some people might think that that's a pretty black and white picture really. You've got the risks involved, for instance in a dog, are diseases such as distemper, parvovirus, which are potentially and almost certainly fatal conditions if an animal contracts them. So the benefits are preventing those. What are the potential risks of giving the vaccine? You can get some local vaccination reactions, where they get lumps and a bit of pain. Some animals will go a bit sleepy, but on balance I think everyone would agree that the risks of doing the vaccines actually are far lower than the benefits involved with doing the vaccination. Things change when as the cases change, and if you start thinking about, a typical situation, the one that we always get into sort of a discussion with clients and with owners, is because there's so much grey in the decision making process. It really needs to be a best fit for the situation, and it changes from patient to patient. But a typical situation would be an older dog with rotten teeth. What are the potential risks? The potential risks are, as the risks are with any sort of anaesthetic. As an animal gets older, the risks of those anaesthetics are higher. Animals being unstable under anaesthetics. Potential things like putting the kidneys under too much strain, and all those sorts of things. Sort of impact on the decisions, and you're going to have a reasonably large cons list when you're looking at the pros and the cons of a procedure, when you're looking at doing it in an older animal. When you start looking at the teeth, for instance, you start thinking, all right, what are we going to gain, and what are the benefits going to be from this? Now, if you have an animal that's just got a little bit of tartar build up on there and a mild bit of gingivitis, the teeth might be a little bit sore. I will say absolutely, I do not feel that we should be doing a dental in this situation, because the risks of the anaesthetic far outweigh the potential benefits. However, if I'm looking at it at a mouth and there are roots that are exposed, there's pus coming out of the teeth and everything else, as far as I'm concerned, when I look at that, regardless of what the risks are that are involved, there might be a few in that cons column, so to speak. I could not imagine living for 3 or 4 years with a toothache. I think anyone that's had one knows how that feels. Now, obviously, you can't put human feelings and human emotions and human pain onto a dog, but you can't exclude it either. It's one thing that you learn in veterinary school. Just because a human feels one way doesn't necessarily mean that a dog or a cat is going to feel the same way, but you can't exclude it either. And I think you need to go under the assumption that what causes us a tremendous amount of pain causes them a tremendous amount of pain, and actually dogs and cats are very, very, very good at hiding signs of pain. So when it comes to this dental question, I would always err on the side of, if we feel that it's going to be causing them discomfort, put yourself in their shoes to a degree and think, would you want it done if you were them, and go from there. And you really need to sort of try and put some value on that, and on the quality of life and the animal's welfare, because the honest truth is the length of an animal's life is important, but the quality of the animal's life, in my opinion, is probably 10 times more important. And there's no point, in my opinion, an animal going on for 4 or 5 years of life if they're not going to enjoy it, if they're going to be walking around with a sore mouth, not wanting to eat anything, and just wishing someone would pull their teeth out, so to speak. So that, again, is one example. There are loads and loads and loads and loads of examples, and we could go on about this for hours, and it's a big, big debate amongst vets and between vets and clients, and the honest truth is because there is no absolute answers. what I would just want people to think about is whenever you're thinking about any procedure, you know, taking your animal into the vet or anything, there's going to be a list of benefits and there's going to be a list of risks. And if the benefits outweigh the risks, then my feeling is we should go for it. Sometimes, and almost always, you're going to have your view of the risks and benefits, and the vet will have his view of the risks and benefits, and you're going to have if you have a good relationship with your vet, you should be able to have an open discussion and come up with a decision between you. And that's where it really needs to be. So, those are my views. If you have your own, feel free to post them on the site, and if you have any questions, feel free to contact me at the British Veterinary Hospital. Thank you very, very much. Bye-bye.